to reduce some background noise, and we'll be sure to open it back up a little bit later when we have time for Q&A. But you can always ask any questions you have throughout the presentation in the Let's Chat box, which is right below the attendee box on the right-hand side. And also the materials for this webinar, so a brief overview of SOAR as well as how to get involved, and the PowerPoint for today's slides, or for today's presentation, are going to be in the Key Documents box, which is in the lower right-hand corner. So you can go ahead and click there and download them. I'll also be following up with an email to everyone after this just to make sure they get all of the materials. So just briefly before we get started, a quick reminder that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, and content of CMHS, SAMHSA, or HHS. And with that, I am going to hand it off first to our project director, Kristen Lutfer, and then Cam Viju from Wolf River Consulting to give us a welcome. Kristen?
All right. Thank you, Abby. I just wanted to quickly welcome all of you to this call. I appreciate you taking the time out of your day today to learn a little bit more about the SOAR initiative and the impact that it can make in Native communities. So we are glad you're here and welcome you. Thanks.
Good. Hi, everyone. Thank you for joining us. My name is Kim Viju. I am the managing partner of Wolf River Consulting. I'm a member of the Oneida Nation of Wisconsin and descendant of Menominee Nation, also of Wisconsin. I'm located in Chicago. Many of you on here may have gotten emails from me regarding SOAR. Wolf River plays a role in the outreach and coordination of projects for SOAR to Native communities. So I look forward to getting to know everybody and continuing to work together on this project.
All right, thanks so much, Kim and Kristen. Okay, so we are going to jump right into the content for today's webinar. So what are we here to do today? Our goal for today's webinar is to provide an overview of SOAR, the SOAR online course, and the SOAR process for you guys. So if you've heard about SOAR in the past or are becoming more familiar with it, this will be a great refresher. But if you've never heard of SOAR and you're excited to get involved, hopefully this will really help with that. And we also want to share the importance of SSI and SSDI benefits for those individuals in both rural and urban Native communities. And this will include not only income, but also health insurance, educational opportunities, employment supports, housing stability. It all goes into ensuring that an individual is well in our community. And then we want to offer opportunities for you guys to become involved and really target some ways that you can take some next steps. Our goal is that this is to be a start of a conversation so that you know who to reach out to and the next steps that you can take to become more involved in the SOAR process. So let's start off with the basics. What is SOAR? So SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. Hold on 1 second. I'm just going to go ahead and mute someone. There we go. I think that should do it. So SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And it is a culturally sensitive, trauma-informed, community-based approach to assisting individuals to apply for Social Security disability benefits, so SSI and SSDI. This is for individuals who are experiencing or at risk of homelessness. And we at the SOAR TA Center use a very broad definition of the term at risk. So this could include someone who is living doubled up, living in permanent supportive housing, or anyone who is not able to sustain themselves in order to pay rent within their community. So we also understand that many individuals that we work with may have issues with substance use, and so we like to tackle and address co-occurring disabilities head on. So that is certainly not something that would preclude someone from being able to be served via SOAR. SOAR is sponsored by SAMHSA, the Substance Abuse and Mental Health Services Administration, and it's been working in collaboration with SSA since 2005. And even though there is no direct funding for SOAR, SOAR is active in all 50 states and Washington, D.C. So even though we're not able to provide a dedicated position for SOAR, we are able to work with communities to figure out how they can fund SOAR, how they can potentially reallocate some resources to ensure that this service, which is much needed, is able to be a part of their community. So let's start off with a little bit of the basics. In order to understand SOAR, you need to understand what SSI and SSDI are. And they are the two disability programs offered from the Social Security Administration. So they're very different, but oftentimes people may conflate the two and may not necessarily understand kind of which one people would be eligible for. So let's start off with SSI, or Supplemental Security Income. This is a needs-based program, and eligibility for SSI is based on low income or low resources, and someone's living arrangement is considered. So essentially, if you do not need it, you will not be eligible for it. So there are income restrictions. Someone may not be able to have a certain amount of money in the bank, although we do know that there are many considerations and ways to kind of reduce that income if need be in the eyes of Social Security. So it also comes with a federal benefit rate of $794 for 2021. This does shift every year. It was an $11 increase, I believe, from last year. So if someone is awarded SSI, they will receive $794 a month. Now, you may live in like New York, California. They may have a state supplement, but traditionally it's going to be that $794. Eligibility is based on the protective filing date, or when the applicant first began to apply. And health insurance provided with this is going to be Medicaid. So remember that is Medicaid aid. Social Security, Supplemental Security Income, or SSI, is needs-based. So the other disability program is the Social Security Disability Insurance, or SSDI. And this may be familiar to us because if you ever look at your paycheck every month and wonder who FICA is, that is what is going towards SSDI payments. So if someone has a work history, if they have earned enough work credits, they would be eligible for SSDI. And so how much an applicant will receive will be based on that person's insured status. So if they've had a really long work history over a number of decades, their payments may be higher than someone who just meets those 40 qualifying quarters. The date of eligibility is also based on the date of onset. So when did the applicant's disability begin? And there may be a 5-month waiting period depending on when that disability started. And eventually, someone will be eligible for Medicare, although Medicaid can supplement in the interim. So via the SOAR model, we're always going to apply for both SSI and SSDI because you never know. Someone may be a poor historian and they say they've never worked, but they actually have a really robust work history. So we're always going to be applying for both, and it is actually only one additional form and one additional paper in order to apply. Social Security makes one medical determination, and then after they determine that the applicant is disabled, then they would determine if they would be eligible for SSI or SSDI. So speaking of medical determination, how does Social Security and the Disability Determination Services determine if an applicant is disabled? And I think this is one of the most challenging aspects for a layperson to grasp when it comes to applying for disability. So there are three ways that an applicant needs, or three kind of tenets that the applicant needs to hit in order to be found disabled. First, they need to have a medically determinable physical or mental health condition that is documented. So there needs to be evidence that they have this condition. It needs to have lasted or be expected to last 12 months or more or result in death. So it doesn't have to have lasted 12 months, but it needs to have lasted or be expected to last 12 months or more or result in death. But the key here, and the key thing that most people miss, is that the applicant's disability needs to affect their ability to work and function and work up to substantial gainful activity, which for 2021 is $1,310 a month. So if the applicant can work and make over that amount, they're not going to be eligible for disability benefits. So the reason I go over this is because the main question that Social Security is asking is not, is the person disabled? It's, are they able to work and are they able to earn SGA? So oftentimes people will apply for disability and they'll go in and they'll say, I have a diagnosis of bipolar disorder, and here are my medical records showing that. But that oftentimes is not enough. We need to talk about how the applicant's bipolar disorder affects their ability to function and therefore work up to SGA. So I would say that most of the time people who are disabled are not found eligible, and they're denied on their initial go-around, not because they're not disabled, but because they have not provided a complete application which really outlines the applicant's functioning. So we really view SOAR and access to income as just one brick in the foundation. So if you'll notice here, SSI and SSDI payments are this kind of left corner. And combine that with employment once someone is stabilized, or potential employment during the process as well, health insurance, additional treatment supports, housing, and then you are on your road to recovery and wellness. So we know that $794 a month is not going to be able to support someone long term. It could potentially, but our goal is to really help people to recover so that they are able to do what they choose in life, whether that be go back to work, re-engage with family, have stable housing, anything like that. We also know that when someone has income, that means better access to housing and health care and an increased educational and employment opportunities. Many people don't realize that Social Security has so many opportunities to help people return to work once they have been approved. Also, we oftentimes will see decreases in adverse outcomes, such as incarcerations or hospitalizations, when people have that income and they know that they are stabilized. So what makes SOAR unique? You're probably like, all right, well, so what is the magic trick here? And there really isn't a magic trick. If I could describe SOAR in one word, that word would be proactive. So the onus of the application process and the goal of providing a complete application to Social Security is on the caseworker. It is not going to be on the applicant. We are no longer telling the applicant to go down to Social Security and apply, or I'll help you fill out paperwork, but that's kind of the extent of my knowledge. The application process is driven by the SOAR-trained case manager in collaboration with the applicant, because we know that these are the hardest to serve applicants. They are people who are homeless or at risk of homelessness, who are living with a severe and chronic mental illness or physical disability, and they're not able to work. So they really need the most help that we can provide. So we've really outlined 5 SOAR critical components, and we learn about these critical components through our training in the SOAR online course, which we'll get to in a little bit. So first is serving as the applicant's SSA 1696 representative, which is really the key to the city. So by doing this, you are able to advocate to Social Security on your applicant's behalf. You are able to talk to Social Security and DDS without your applicant present. You can submit applications for them and other documents. But the key thing here is that you will receive a copy of all correspondences that the applicant also receives. So you are the point person there, not your applicant. When I have done applications in my local community here in upstate New York, my applicants never talk to Social Security. They never go into the office until they've been approved. And that's really the power of the 1696 and being able to help applicants through this process. We are going to collect and submit all the applicants' medical records to ensure that the people who are evaluating their claims are getting a clear picture of the applicant's mental health, physical health, and so that we know that it's not just that I have back pain. It's I have back pain, which is caused by this illness, and I also have mental health disability, so they're really getting that complete picture of the applicant. We're going to take those records and we're going to write a medical summary report. And a medical summary report is a 5 to 6 page report which clearly outlines the applicant's medical history, but it also tells the applicant's story. We don't want the applicant to just be a stack of medical records. That is not who the applicant is. But instead, we want them to be a person that the adjudicator at DDS can see. They will never physically see them, so we want to make sure that we can, through our writing, they can see them. So with this, you are going to talk about the applicant's functioning, any trauma that they've experienced, their educational history, substance abuse treatment, anything that will contribute to say, they're not just how their disability affects their ability to function and therefore work. We are also going to obtain a co-signature whenever possible on the medical summary report from what Social Security calls an acceptable medical source. And this will ensure that the applicant's medical summary report is elevated to medical evidence in the eyes of Social Security. But overall, we are submitting complete applications. SOAR is not a magic word. There is no stamp that goes in that says SOAR and it's automatically expedited. What makes SOAR unique is the completeness of the application that you are providing. It is, we are utilizing Social Security's tools and the documents and forms that they have to the absolute fullest so that we're able to provide complete applications. So now you're probably wondering, does this work? And the answer is yes, absolutely. We have cumulative outcomes of approximately 65% in an average of about 110 days. Now, the 110 days is a little longer this year because there is a pandemic and things have slowed down a bit. But I think that this 65% is really key when you're able to compare that to the traditional approval rate. So if someone were to go in and apply for Social Security disability benefits, just a layperson, the average likelihood that they would be approved is about 29 to 30% on initial. Now, if someone's experiencing or at risk of homelessness and symptomatic, the likelihood that they would be approved on initial application if they apply on their own is about 10 to 15%. And that's where we see the common common phrases come in, like you have to be denied 3 times in order to be approved. You have to go to an appeal. And we know that that's not true. That's not the case. But the evidence that they were supplying to Social Security and DDS was just not enough to meet that threshold for approval. So that's really where SOAR can come in. And here's our initial approval rates again. So, initial is 65% approval rate and an average of 115 days. But what I think is also really speaks is the financial outcomes. So the average general assistance reimbursement is going to be around $3,100. So if an applicant is receiving general assistance from a county or a community, when they're approved, the county would be paid back for services rendered from the applicant's back payment, not from any checks moving forward, but that is money that is coming into the communities. States can also, treatment providers can also be reimbursed the cost of uncompensated care or treatment that had not been paid. And on average, that's about a little over $10,000 on average. And average retroactive payments can be upwards of almost $7,000 for an applicant because we know that once they apply, they can go back to the date that they became disabled or the date that they initially applied. So some back payment may be owed to the applicant as well. Now, those are our national approval rates. We also have some top 10 states, and many of you on this call may be from some of our top 10 states. So these states have a 76 average approval rate on initial application. And what this means and why they've been so successful is because they use the critical components to the fullest. Not only are they submitting a number of applications, on average at least 2 a month, they are ensuring that they are submitting quality applications to SSA and DDS, and their results speak for themselves. So another key to success is for SOAR is absolutely community collaboration. So if we look at this circle in the middle, this would represent the SOAR applicant. And what we know is that person is not just a person experiencing homelessness. Perhaps they are a person experiencing homelessness who's also in need of housing. Perhaps they're a veteran or involved in the criminal justice system or going to school, or perhaps they're a member of a Native community or someone in need of health care. So it's really important that all of these players collaborate to ensure that this person in the center is served and is able to receive the services that they need. So while SOAR and the SOAR training is individualized in that it is within one case manager, and a case manager can do so much and make so much change in an applicant's life, it really does expand out to how can we support this individual before, during, and after the application process as well. So how do we get involved with SOAR? At its core, we have a SOAR online course. And the SOAR online course, located on our website, it offers standardized training across all geographic areas. So I know what is being trained in New York is being trained in New Mexico and in Nebraska and Washington State, that everyone is getting the same training. And throughout the 7 classes, it will really take you through how to learn, and it'll teach you how to do SOAR and complete all the SOAR critical components. Once someone is trained, they will be connected with their local SOAR initiative. Now you may ask, do I have a local SOAR initiative? It will depend on where you are located, but what everyone has, what every single state has, is a SOAR TA Center liaison, as well as your SOAR state team lead and potentially local leads. And then you also have myself, Kristen, and Kim, who are always here to support. The SOAR online course is free. It's open to the public. It is self-guided. There is no cost associated with it. And once you complete it, it comes with 20 free CEUs through the National Association of Social Workers, or NASW. Now this course is unique. We estimate that it takes approximately 20 hours to complete. And you might be thinking, oh my goodness, why does it take 20 hours? And the reason it does is because it is split into 2 pieces. You have the articles that you can see here, so you're really reading about how to become a SOAR-trained caseworker and the critical components of SOAR. But you are also completing a practice case component. And this practice case, and within this practice case component, you are assigned a client. You are assigned either Mike or Colette. Mike is a veteran. He is street homeless. He has a diagnosis of schizophrenia, PTSD, and hepatitis C. Colette is currently incarcerated. She is a mother, not currently having custody of her children. She has a diagnosis of bipolar disorder, hypertension, and diabetes. So you will get to know these applicants. And through this course, you will complete all 5 Social Security forms that are needed for an application, as well as write a medical summary report, which I spoke about earlier. Once you have done this, you upload all these documents, and it's submitted to staff at the SOAR TA Center. And we review each application packet line by line and give you real-time feedback on your practice case. If we've reviewed it and we feel as though this application would be approved, you are going to pass, you'll get your congratulations email and certificate, and you would be able to then work with applicants. If we feel that you need to revise and resubmit a little bit, then we'll let you know about that, and you will have that opportunity to resubmit and have it reevaluated prior to our final decision. So like I said, and this document is located in the key documents box as well as on the SOARworks website, we estimate the training will take about 20 hours to complete. And that is reflective of how long we feel it will take to complete an actual SOAR application. We estimate that each SOAR application takes 20 to 40 hours over the course of 60 days. And while that seems like a lot, I would encourage you to think about a couple things. 20 to 40 hours will vary. If you work in a supportive housing program or you have great access to the applicant, they are great at making appointments, it may be more of a 20-hour per application. However, if you're working with an outreach team, you have a difficulty getting a hold of the applicant, they're not great at making appointments, it may be more of a 40-hour commitment over the course of 60 days. But also think about time spent on the front end. If you can think about an applicant that maybe you've been working with for years and perhaps they've been denied Social Security disability benefits, and you continue to think if we could just get them benefits, perhaps we could get them into housing. The amount of time you may spend with them on the front end, that 20 to 40 hours to really get them those benefits, will make up for the time you could potentially spend on the back end where the applicant is in appeals for months or perhaps even years. So it's really important to talk with your supervisor, your project director, and staff at your agency about if you become SOAR trained, how they plan to allocate your time to be able to complete SOAR applications. That is a really important piece. This training is incredibly comprehensive. It is time consuming. So we want to make sure that the amount of time that you have put in to your, that you've put into this training, you're able to use it on the back end and really able to use it to help applicants in your community. The other thing I just want to mention real quick is our outcomes tracking. So we track outcomes through the SOAR online, the online application tracking system, or OAT as we call it. And this is just kind of a brief overview that once someone is trained and they are working with applicants and they begin to get decisions in, so yes, this person has been approved, we're going to want to know about that. And you would track those in a separate system, the OAT system, of which we can have a big conversation about later. But just know that there is kind of a tracking requirement, although there is no personally identifiable information that you provide. We just want to know if your application has been approved, denied, how long it took, and if the critical components were followed. So let's talk a little bit about the type of technical assistance that the SOAR TA Center can provide. So the SAMHSA SOAR TA Center is national, and like I mentioned, each one of our states has a SOAR TA Center liaison, as well as many states will have state team leads and then also local leads. So I'm going to go ahead and put in the chat the directory. And in that, you can navigate to that after this call, and you can check out the activity of SOAR in your state. You can also absolutely feel free to reach out to me, and I can talk with you about if there is current SOAR activity. But even if there isn't, you can still become involved in SOAR. So what can the TA Center assist with? We can assist with planning for SOAR implementation. This could be talking with people at your agency, or talking with your supervisor, or talking with you about the SOAR online course and next steps once you're able to become involved in the process. We can also help facilitate SOAR 101. So this would be similar to a presentation like we're doing right now, where we provide an overview of SOAR. Perhaps it's for your agency or your community, just to get them involved and excited about SOAR. We can also help bring stakeholders together to discuss the benefits of SOAR within your agency or within your community. So what this could potentially look like is bringing together stakeholders such as executive directors, program managers, tribal leaders, to talk about SOAR and how it could be a benefit. This could be, and keep in mind, all of these things are completely driven by you. I know that myself in upstate New York, I am not familiar with your community. And at the TA Center, we are very cognizant of this, and we want you guys to be the driving force of this. And we will provide the technical expertise around SOAR, but you guys are the experts in your community in figuring out how this will work. We're just here to assist. We can also help you to begin a pilot program. And a pilot program is so great to begin SOAR. So maybe you start with 1 or 2 or 3 caseworkers, and you would have them trained. You would start out doing some applications, and then once you see that work for maybe 6 months, 9 months to a year, then we're going to work on scaling it up and expanding it. We can also assist with SOAR online course cohorts and assistance with the SOAR online course. So let's say you've got a bunch of people at your agency, you've talked with your supervisor, you want them to become trained in SOAR. So what we would do is have a facilitated cohort where we would meet weekly over 3 to 5 weeks, depending on your time frame, and we would check in on how the course is going. So in the first week, you would complete classes 1 and 2, and then we would check in and review those classes. The next couple weeks, you'll do classes 3 and 4, check in, and so forth. So it's just really a supported cohort to complete the online course while the caseworkers are still doing the independent work. Also just supporting SOAR-trained caseworkers in general. I like to say that the SOAR TA Center is kind of like alphabet soup. Like, we provide A to Z technical assistance. You can reach out to me as a SOAR-trained caseworker and say, I'm having trouble figuring out what this question means on this form. Or I'm having a hard time understanding this concept. We can absolutely help with this. We get calls every day from people who are in need of assistance throughout the country. But you can also call me up and say, hey, I'd love for you to facilitate a SOAR 101. What's the best way to talk to my supervisor? Can we figure out ways to address funding to hopefully get some funding for SOAR? We can really provide all of that technical assistance. But overall, someone's listening to some music. Put us on hold. Okay, there we go. Overall, though, we're really hoping to continue to build resiliency in Native communities, because we know that Social Security disability benefits can be a crucial source of income for American Indian and Alaska Native individuals who are residing in urban, rural, or reservation-based communities. SOAR can work in all of those areas. It's just a matter of figuring out how and ensuring that it is working for your community. And overall, SOAR can provide timely access to SSI and SSDI and really bring that income into the local community, which helps stabilize housing, it helps stabilize the individuals, it has increased employment opportunities, and really we're going to help those who are most vulnerable in our communities. SSAs, and now, I'm just thinking about this. Annie, I totally forgot that you were going to be on the call, and I'm so happy I remembered it. Annie Walters is with SSA, and I'm hoping that I'm not putting you too much on the spot, but maybe I could turn this over to you to talk about some of the services that the Social Security Administration provides for Native communities.
Am I on mute? Can you hear me just fine?
Yes,
okay.
We can hear you.
So thank you for allowing me to come on today. I really appreciate it. So the whole point of Social Security coming on today is to bridge this communication barriers, if we have any at all whatsoever. And so thank you, SOAR, and thank you for Wolf River Consulting Group for putting on this platform so we can have this communication platform to allow everybody to have a say in all what we have to do today. So we wanted to go over some of the information that, oh my gosh, Abby has so much information to provide you guys today. So I'm just going to add a little bit more to it so you have a better understanding of it. So video service delivery locations, it's really meant for rural areas. There's a few in certain states, like maybe in the north, like northern Nevada. Sorry. And so the idea is that as people live in rural areas, they're not able to go to their Social Security offices. So these VSDs, they're actually in community centers, in reservations, in nursing homes, where you can actually access a Social Security representative and get your application processed, even though the office may not be close to you. So you can travel to these locations. So travel consultation and coordinate plans are so important. Again, Abby mentioned that this is a community-driven thing, okay? We have a homepage that's dedicated to American Indians and Alaska Natives. If you go to our homepage, and I could send this to Abby so she could disseminate this information, but we have this 50-page guide specifically for tribal service reps. If you have questions, concerns, it goes over the entire program, anywhere from employment networks to Social Security to SSI. So any questions that, anything that Abby has brought up has been amazing. So those are the things that you want to look for and check out. So you can get it on a PDF format, or you can print out yourself and check out the information. Last but not least, there's the ticket to work, right? Like Abby said, SOAR is a model that is follow to a T, and that's the reason why it works, okay? There is no magical pill like we talked about, and it's just a formula. So when we continue to follow that specific formula, we have great products that's given through the Disability Determination Services. It allows for great results. So SOAR allows people to not just stay on Social Security and SSI benefits and rely on it, but we look towards the future. We see how people are getting off these benefits and how they're going back to work and how they're able to earn more money than any Social Security or SSI benefits can offer them. So if you happen to be an interested party in terms of like the federal government agency having a contract with you, and these are free for you to become an employment network, you're welcome to join the Ticket to Work program, and you could be the employer that's supplying that job for that Social Security or SSI recipient. So as a public affairs specialist in the Nevada area, we are doing a lot of great things. I connect with the SOAR leader that's in the northern southern Nevada area, and every month we have a meeting, something like this, and we talk about our challenges, we talk about all the success stories that we have, but we bridge that communication so that we can have the opportunity to see how we can go ahead and help the underserved population, and especially with the American Indians and Alaska Native, we want to be able to bridge that communication gap that we have at this point in time in our area. And it doesn't matter where you are at this point in time, we can absolutely do that for your area too. So thank you again for your time today. I didn't want to take over, just wanted to have a little bit of time to talk about what we have here today. Thank you so much, everyone.
Thank you, Annie. Yeah, we really appreciate you coming on today. Thanks. All right, so what's next? We're just going to present a couple kind of what's next, and then we'll open it up for question, answer, and discussion. So if you've liked what you heard today and want to figure out how to pursue this more, there are a couple great places to start. The first is to explore these links here, and I'll go ahead during the chat too and put some of these in the chat. Also, make sure to reach out to myself. My email address is there. I'll also go ahead and put it in the chat box. And it can be something as simple as like, hey, I listened to your webinar and I want to talk with you and Kim to see what we can do next. Or, you know, I'd love to know if there is a SOAR initiative happening in my community, and I'd be more than happy to connect you with your SOAR TA Center liaison. But like I said, I really hope that this is going to be a start of a conversation and that you guys are interested. We have been working really hard, and in collaboration with Wolf River, our collaboration with Wolf River has just been amazing to really help expand this initiative, and we're excited to see where it's going to go in the future. So Kim, is there anything else you'd like to add before we open it up for Q&A? Oh, sorry, Kim, I think you're muted. Hold on one second. Let me unmute you.
I did get a couple of questions, and I'm wondering if maybe you could elaborate a little bit more about eligibility. You know, I know that it's open to everybody, but if you could elaborate a little bit more about who can take the course and
so who's eligible for benefits and whatnot?
No, who's eligible to take the course or to participate?
Oh, to take the course. I'm so sorry. I totally misheard that. The short answer is anyone. Anyone is eligible to take the course. There are no requirements education-wise. It's not like you have to have a bachelor's or master's or anything like that. There are requirements, and I say requirements with air quotes, really come into play with, are you going to be using what you know to complete SOAR applications? So the course, like I said, is 20 hours, and it's a lot of work. So do you need to be doing that full course if you're not going to be completing applications? Perhaps you might just want to take the first class of the SOAR online course, which is SOAR 101. That might be helpful. So there's no requirements to do that other than that we hope that once you are trained, you will go on to complete applications. I will also say it is helpful if you're thinking in terms of your staff and whatnot that you are able to write well, because writing will be a key component of this, writing that medical summary report, and also you'll need to interact with applicants but also with Social Security, so being able to kind of talk with both applicants and also at the systems level will be really helpful. Awesome. So I see some questions coming in. So while those are coming in, I am going to put some more links in the box, which will just be helpful. I'll go ahead and put the link to the SOAR Online course. And again, like I said, you can feel free to go into the SOAR Online course, poke around. There's no like, if you register, you must finish. That is by no means SOAR, so you can definitely just kind of take a look at it as well. There we go. And then I'm also going to put this link in here. And feel free to also ask your questions verbally. I did have to mute quite a few people during the presentation, but you can go ahead and unmute yourself, or you can ask your questions verbally. Oh, yes. Okay. Oh, my goodness, Stephanie. Okay, so let me read it before I get too excited. I do remember Stephanie. We have chatted before. I think I came to Arizona. Did I meet you in Arizona? I think so. Do you think she said she secured funding for a staff person for permanent supportive housing communities? And would you have a job description? And the answer is absolutely. So not only do we have sample job descriptions, which I will go ahead and put in the chat box, we also have, I'll put two things in. We have a hiring and supervision toolkit, which is here. And then we also have a bunch of sample job descriptions, which is right there. Now, that sample job description may not be exactly what you're looking for. So please let me know once you've taken a look at them if there's anything I can do to help tweak it. And I can also bring in your liaison, Dan, and we can talk a little bit more about it. But those both will be a great starting point. And that SOAR Hiring and Supervision Toolkit is relatively new, so probably within like the last 6 to 9 months. So taking a look at that, and it really talks about the type of caseworker you're looking for, expectations of like where can they sit and do they need a filing cabinet, and how much outreach, you know, in non-COVID times are available will be great. And so Maylene said, I believe it will be extremely beneficial for SOAR tribal representatives to have training in regards to stigma about mental health diagnoses. Absolutely. Yep. You're spot on. All right. Any other questions? And as you know, feel free, even, you know, later on you're thinking about questions or, you know, down the road, you can always reach out to me. We are also going to be doing these quarterly. This is our second orientation of 4, so we will have another one in April. So, of course, we can speak before then, but if you have colleagues and whatnot, we'd be more than happy to talk with them. Maylene said, additionally, many of our health services are considered life and limb only, so access to consistent medical care and preventive care will pose limitations for medical evidence. Yes, that can absolutely be a hard thing. So we do need to have medical evidence to apply for Social Security disability benefits. But we understand that sometimes it's challenging to get consistent treatment. And Social Security has ways of developing that medical evidence if it's not already there. So through consultative exams, perhaps you could help them get treatment. So know that if someone doesn't have a really robust medical history, it's okay. They can still be a good SOAR applicant. The application process will just look a little bit different, and that's really when you can reach out to myself, your SOAR TA Center liaison, and we can talk through that. And yes, Becky, it is an awesome program. I appreciate you saying that, and we can hopefully talk more about it with your community. All right, so I'm going to send out an email with this recording and some additional resources to everyone who registered. So you'll have this and can pass it along. But again, please feel free to reach out to myself or Kim. We are more than excited to get your SOAR initiative off the ground, or just answer any questions you have about disability benefits. So thank you so much, everyone. Thank you, Kim. Thank you, Annie. And we'll look forward to talking with many of you again soon. Have a great rest of your day, guys.